Over 3 million Americans are already losing healthcare coverage, and most don't even realize it's happening until it's too late. Imagine going to the doctor, handing over your card and hearing you're no longer covered. No warning, no clear reason, just silence from a system you trusted. This isn't a future problem. It's already unfolding right now in 2026. Behind the scenes, a quiet reset of eligibility rules, hidden paperwork traps, and strict income limits is pushing people out, especially seniors. It's not always about earning more or doing something wrong. Sometimes it's a missed letter, a delayed form, or a system glitch. And just like that, coverage disappears. Why isn't everyone talking about this? And more importantly, how do you protect yourself before it hits you? In this video, we break down the 10 hidden reasons millions are losing healthcare and the exact steps you can take today to stay covered, avoid costly mistakes, and stay one step ahead of a system that doesn't wait for anyone. Number 10. Medicaid eligibility redetermination shock. Right now, one of the biggest hidden shifts in healthcare is something called redetermination, and it is quietly removing millions of people from coverage. During the pandemic, governments paused eligibility checks to keep people protected. But now, in 2026, that protection is gone. States have restarted reviewing every single case. On paper, this sounds routine. In reality, it has become a mass-scale filter system. If your income changed, if your paperwork is outdated, or if you simply missed a notice, the system can mark you as ineligible. And here's the part most people don't realize. You are not always clearly warned before coverage stops. The real danger lies in how this process works behind the scenes. Systems rely heavily on automated checks. That means small data mismatches, like an old address or delayed income update, can trigger instant removal. Studies and state reports show that a large percentage of people losing Medicaid are not actually ineligible. They are dropped due to administrative gaps, not real disqualification. This creates what experts call a procedural loss. In simple terms, you didn't fail the system. The system failed to process you correctly. But the result is the same. No coverage when you need it most. So what can you do right now? Act before the system acts on you. First, log into your state Medicaid portal and check your status today, not next month. Second, update every detail: income, address, household size. Third, watch your mail like it contains money, because it does. If you get a notice, respond immediately, even if it seems minor. And finally, call your local Medicaid office and confirm your active status every few weeks. This is not about panic. This is about staying ahead. Because in this new system, silence is not safety, it's risk. Number 9. Income threshold cliff effect. There is a hidden line in the system, and crossing it by even $1 can cost you your health care. This is known as the income threshold cliff. Medicaid and similar programs use strict income limits based on federal poverty levels. On paper, it looks fair. But in reality, it works like a switch, not a slope. If your income goes even slightly above the limit, your benefits can stop completely, not gradually, but instantly. That means a small raise, extra work hours, or even temporary income can trigger a full loss of coverage. The system does not adjust smoothly. It does not say, you earned a little more, so we will reduce your support slowly. Instead, it draws a hard line and enforces it without flexibility. Research and policy analysis show that many people face what experts call a benefits cliff, where earning more money actually leaves them worse off overall. Imagine gaining a small increase in income, but losing access to healthcare that would cost thousands of dollars out of pocket. This creates a silent trap where progress can lead to sudden financial risk. So, how do you protect yourself? Track your income with precision, not estimates. Keep a monthly record of every dollar coming in, including part-time work or bonuses. Before accepting extra hours or a raise, check your eligibility limits and calculate the impact first. If you are close to the threshold, speak to a local benefits advisor and explore transition programs. And most importantly, report income changes early, but smartly, so you stay in control of the timing. This is not about avoiding growth. It is about moving forward without falling off a financial cliff you didn't see coming. If this made you pause and rethink your own situation, tell us, what would you do if your health care disappeared tomorrow without warning? Your voice matters more than you think. Before you leave, watch our previous video to stay one step ahead of the system and protect what matters most. We put hours of deep research and effort into every video to bring you real, life-changing insights. So please subscribe to our channel. It is just one click, and it truly helps us keep going. Number 8. Medicare Advantage Plan Cuts. A quiet shift is happening inside many Medicare Advantage plans, and most people only notice when it's too late. These plans often look attractive at first. They promise extra benefits, lower premiums, and added services. But behind that promise, networks can shrink, and costs can slowly rise without clear warning. In 2026, policy changes and cost pressures are pushing many providers to adjust coverage. Doctors may leave networks. Certain treatments may need new approvals. And suddenly, the care you relied on is no longer as easy or as affordable to access. The hidden system here works through contracts and yearly adjustments. Insurance companies renegotiate deals with hospitals and doctors. When costs increase, they may respond by limiting which providers you can see or by raising out-of-pocket expenses. Research shows that narrower networks can reduce access to specialists, especially for seniors with ongoing conditions. You may still have coverage on paper, but fewer real options in practice. This creates a gap between what you think you have and what you can actually use when you need care most. So what should you do now? Do not assume your plan stays the same each year. Review your Medicare Advantage plan during every open enrollment period. Check if your doctor is still in-network. Look closely at changes in copays, drug coverage, and referral rules. If something feels tighter or more limited, compare other plans and be ready to switch quickly. Also, call your provider and confirm coverage for any ongoing treatments. This is not about fear. It is about clarity. Because in this system, what you don't check can quietly cost you the most. Number 7. Rural hospital closures. Across many parts of the country, hospitals are not just struggling, they are quietly disappearing. And for people living in rural areas, this is not just an inconvenience. It is a direct threat to access, speed, and survival. In 2026, financial pressure, staff shortages, and low patient volumes are forcing more rural hospitals to shut down or cut key services. On the surface, this looks like a business issue. But underneath, it creates a dangerous gap where care becomes distant, delayed, or completely out of reach. The hidden system behind this is driven by funding models and patient flow. Rural hospitals often depend on lower reimbursement rates and a smaller number of patients. When costs rise and support falls, these facilities cannot sustain operations. Studies show that when a rural hospital closes, emergency response times increase and health outcomes can worsen, especially for heart attacks, strokes, and trauma cases. You may still have insurance. You may still be eligible. But if the nearest hospital is now hours away, coverage alone cannot save time. And time is everything in an emergency. So what can you do right now? Map your healthcare access before you need it. Identify the closest open hospitals and urgent care centers. Know the fastest routes and travel times. If you live far from care, create an emergency plan with family or neighbors, including transport options. Keep a list of critical medical information ready at all times. And if possible, schedule regular checkups earlier, not later, to avoid last-minute emergencies. This is about preparation, not panic. Because in this changing system, distance is becoming the new risk, and planning is your strongest defense. Number 6. Administrative errors and system delays. One of the most dangerous threats to your healthcare is not illness. It is a simple system error. Right now, thousands of people are losing coverage not because they are ineligible, but because something small went wrong in the process. A missing document, a delayed update, a letter sent to the wrong address. And the system does not pause to double-check. It moves on without you. In 2026, as millions of cases are being reviewed, these small errors are happening more often and affecting more people than ever before. Behind the scenes, most of this system runs on automation. Data is pulled, matched, and verified by software before a human ever looks at it. If the system cannot confirm your details instantly, it may flag you as ineligible by default. Studies and state audits have shown that a large portion of coverage losses come from what experts call procedural terminations. This means people lose benefits due to process failures, not because they no longer qualify. The system is built for speed, not perfection. And when volume increases, mistakes move faster than corrections. So, how do you protect yourself in a system like this? You become your own safety check. Keep physical and digital copies of every document you submit. When you send something, confirm it was received. Never assume. Set a reminder to check your status every 2 weeks, even if nothing seems wrong. If you get any notice, respond immediately and keep proof of your reply. And most importantly, do not wait for a problem to appear. Verify your coverage regularly before you need care. Because in this system, a small delay can turn into a complete loss, and prevention is entirely in your hands. Number 5. Rising prescription drug costs. There is a silent pressure building inside the system, and it shows up every time you go to the pharmacy. Even with new policies meant to control prices, many people in 2026 are still facing higher out-of-pocket costs for essential medicines. You may have coverage. You may have a plan. But when the bill arrives, the numbers tell a different story. This is not always due to one big price jump. Instead, it happens through small increases, tier changes, and coverage limits that slowly shift more cost onto you. The hidden mechanics are complex, but the impact is simple. Drug plans often use tier systems, where medications are grouped by cost level. If your drug moves to a higher tier, your share increases instantly. At the same time, deductibles and copays can reset or rise each year, even if your medication stays the same. Research shows that when drug costs go up, many patients begin to skip doses or delay refills. This creates a dangerous cycle where saving money today can lead to serious health risks tomorrow. The system does not always make these changes obvious. You feel it only when you pay. So what can you do right now? Start by reviewing your medication list with your doctor or pharmacist. Ask if there are lower-cost alternatives or generic versions that work the same way. Compare prices across pharmacies and use verified discount programs when possible. Do not wait until you run out. Plan your refills early and check costs in advance. If your plan changes, reassess immediately. This is about staying one step ahead. Because in this system, the real cost of medication is not just a price, it is the risk of going without it. Number 4. Work requirements expansion. A new layer of rules is quietly entering the system, and it ties your healthcare to your work status. In 2026, some programs are expanding requirements that ask people to prove they are working, training, or actively seeking work to keep their coverage. On the surface, this may sound reasonable, but in practice, it creates a fragile link between your daily life and your medical security. If your hours change, if your job is unstable, or if you fail to report activity on time, your coverage can be paused or even cut off completely. The hidden mechanics are not just about working, they are about reporting. The system requires regular updates, often monthly, showing proof of hours or activity. If this data is missing, late, or entered incorrectly, the system may assume noncompliance by default. Studies from past policy trials show that many people who lost coverage were actually working, but failed to meet reporting rules, not work rules. This creates a silent gap where the burden shifts from eligibility to paperwork precision. And for older adults, caregivers, or those with unstable schedules, this system becomes harder to navigate with each passing month. So what should you do now? Track your work activity clearly and consistently. Keep simple records of hours, dates, and any job-related efforts. Set reminders to report early. Never wait until the last day. If your situation changes, update it immediately to avoid gaps. Reach out to local support offices if you are unsure how to report correctly. And most importantly, treat reporting as seriously as the work itself. Because in this system, it's not enough to qualify. You must prove it on time, every time, or risk losing everything. Number 3. Aging population strain. A powerful shift is happening quietly in the background, and it is changing how fast and how well you can get care. Every day, more Americans are turning 65 and entering the healthcare system. In 2026, this wave is growing faster than ever. On the surface, this looks like a natural part of life. But underneath, it is placing intense pressure on hospitals, doctors, and support services. The system is not just serving more people. It is serving more people who need frequent, complex care. And that changes everything. The hidden mechanics come down to capacity versus demand. There are only so many doctors, nurses, hospital beds, and appointment slots available. As demand rises, wait times grow longer, appointments get delayed, and resources become harder to access. Research shows that aging populations increase the need for chronic care management, which requires time and attention. But when the system is stretched, that time becomes limited. You may still have insurance. You may still be eligible. But access becomes the real challenge, not coverage. And delays in care can lead to worsening conditions that could have been managed earlier. So what can you do right now? Move earlier, not later. Schedule checkups and screenings ahead of time, even if you feel fine. Build a relationship with a primary care doctor so you are not starting from zero in an urgent moment. If possible, choose appointment times that are less crowded, like early mornings. Keep track of your health records so you can act quickly when needed. And most importantly, do not ignore small symptoms. Address them before they grow into bigger problems. Because in this system, timing is becoming as important as treatment, and early action is your greatest advantage. Number 2. Limited awareness and misinformation. The most dangerous threat in this entire system is not a rule. It is what you don't know. Right now, millions of people are losing healthcare simply because they are unaware that changes are happening to them in real time. No alerts, no clear explanations, just letters that look routine, emails that get ignored, or messages that never reach the right place. By the time many people realize something is wrong, their coverage is already gone. This is not rare. It is happening on a massive scale in 2026. The hidden system depends heavily on communication, but not always effective communication. Notices are often sent by mail or through online portals that people rarely check. If you miss one deadline or fail to respond in time, the system may assume you no longer qualify. Research and surveys show that a large number of coverage losses are linked to missed notices, confusion, or misinformation, not actual ineligibility. People believe they are still covered because nothing felt urgent. But in reality, the system moved forward without them. And once coverage stops, restoring it can take time you may not have. So what can you do right now? Turn awareness into a daily habit, not a one-time check. Look at your mail carefully, even if it seems unimportant. Log into your healthcare account at least once a month and verify your status. Set reminders on your phone so nothing slips through. If something is unclear, do not guess. Call and confirm immediately. Talk to family members and make sure they are also informed. Because in this system, what you miss can hurt you, and what you know can protect you. Number 1. Policy changes already in motion for 2026. This is not a warning about the future. This is a report on what is already happening right now. As of April 2026, multiple healthcare policy changes are no longer proposals. They are active, enforced, and affecting real people every single day. The system is shifting through updated eligibility checks, stricter verification rules, and tighter funding structures. On the surface, these changes are described as adjustments or returns to normal. But in reality, they are reshaping who stays covered and who quietly falls out of the system. The hidden mechanics are built on timing and transition. Policies do not hit all at once. They roll out in phases, which makes the impact harder to see, but more dangerous over time. One change affects eligibility. Another affects cost. Another affects access. Alone, each seems manageable. But together, they create a chain reaction where small gaps turn into full coverage loss. Reports and policy analysis show that many people are caught off guard because they are reacting after the change has already taken effect, not before. And in this system, late action often means limited options. So what should you do right now? Shift from passive to proactive immediately. Review your current coverage in detail. Do not assume anything is unchanged. Contact your provider or agency and ask direct questions about your status under current rules. Create a backup plan, including alternative coverage options or financial preparation for gaps. If something feels uncertain, act on it now, not later. Because in this system, waiting is the biggest risk you can take, and early action is the strongest control you have. What we are seeing right now is not just a policy shift. It is a deep change in how healthcare access is controlled. Step by step, the system is moving from automatic coverage to constant verification, strict limits, and silent enforcement. This affects your freedom to choose care, your ability to act quickly in emergencies, and your peace of mind every single day. You may still have coverage today, but the real question is, how secure is that coverage tomorrow? Because in this new environment, access is no longer stable. It is conditional, monitored, and always at risk of disruption. The financial impact is just as serious. When coverage slips, even for a short time, costs rise fast and without warning. A simple doctor visit can turn into a heavy bill. A delayed prescription can become a bigger health problem. Research consistently shows that gaps in coverage lead to higher long-term costs, not savings. And for many people, especially seniors, one unexpected medical expense can shake years of financial stability. This is not just about healthcare. It is about protecting your savings, your independence, and your future security. At a deeper level, this shift changes your position in the system. You are no longer a passive user. You are now responsible for tracking, verifying, and defending your own access. The system will not slow down or remind you twice. It will move forward, with or without you. That is why awareness, preparation, and early action are no longer optional. They are your strongest tools for staying protected. Because in this new reality, those who stay informed stay covered, and those who don't risk being left behind. If this made you pause and rethink your own situation, tell us, what would you do if your health care disappeared tomorrow without warning? Your voice matters more than you think. Before you leave, watch our previous video to stay one step ahead of the system and protect what matters most. We put hours of deep research and effort into every video to bring you real, life-changing insights. So please subscribe to our channel. It is just one click, and it truly helps us keep going.